New guidelines from the American Cancer Institute bumped the recommended age now for women to get mammograms from 40 to 45, even though over 40,000 women are expected to die from this horrible disease this year. So how can less screening actually be a good thing? Joining me now, National Review reporter Jillian Melchior, and back with me as well, Gina Loudon. Jillian, I'll start with you on this. It's, they come out with these new guidelines, and it doesn't make anyone feel good when you say, okay, go from 40 to 45, and I was just talking to Tammy, at 55, they actually slow it down even more.
Yeah, I think this is completely insane. I mean, if you look at it over the last 20 years since breast cancer detection has been on the rise, 30% decrease in mortality. This is something that's going to have a huge impact on women's health. I think it's a bad recommendation, and insurers are going to pick up on this and use it as a way to save money.
Do you think insurers might have had something to do with it in the first place?
Yeah, it's entirely possible. I mean, in 2009, you saw a government panel making the same recommendation and citing cost savings. So I'm definitely suspicious that there's a political angle to this. I think what's really unfortunate, though, is there was a Harvard study looked at 71% of women who died of breast cancer fell into the 20% of women who do not have mammograms regularly.
Early detection. We hear that for everything, particularly breast cancer, Gina.
Yeah, there's another part of this study that I think is particularly notable in light of everything that was just said, and that is that after 50, they're only recommending every other year for women. This just sort of smacks of death panels, and I think let's remember, too, whose studies they're citing. They're citing the American Medical Association and ACOG, both of whom endorsed Obamacare, and under this, there's no way to argue, women are getting less care, and more women will die from this under Obamacare. Take note, folks,
So you're linking this to Obamacare and the warnings from Sarah Palin and others of potential death panels, just a consequence of no money in the system.
I mean, I think that's exactly right. And we've seen this in other aspects of our health care, and we're hearing it from our friends and neighbors that there is just less health care available. There are less doctors, there's less access, and there's more expense for everybody, especially millennials, who this will affect throughout their entire lifetime if Obamacare isn't overturned somehow.
Gina, you're one of the great mothers out there. There's now a new report out that they're saying, hey, you should never drink during pregnancy, ever. I mean, this is another thing where the pendulum swings one way or the other. I've seen women drinking wine while they were pregnant. When I grew up, that was a no-no. All of a sudden, it's okay, and now it's not okay. Where are we on this?
This should tell people that you need to read these studies for yourself, and everybody needs to sort of be their own doctor and their own healthcare manager and their own researcher. You need to be able to look at these studies because you're right. A different study comes out every week that makes a different recommendation. My own OB told me when I was pregnant I should have a glass of wine every single day. They do change constantly, and that's why people need to be able to do their own research and dissect these studies to see what's legit.
All right, ladies, thank you both very, very much.